Hello, everybody. I'm in my office today, and the topic of the day will be dealing with difficult patients. Once in a while, we get one of those that really makes our blood boil, and the twitching. I start getting the twitching of the eye, and really feel like tell them that this is the door. You have 1 minute to get out of my office and never come back. But in reality, you're not going to do that, of course, because we're all professionals and we have to behave professionally when those situation arises. So when something like this happen, people start behaving aggressively, disrespectfully toward you or your staff. You really have two choices. Number one, you try to smooth the situation. You try to show your empathy. You try to speak to the patient and see if there is a way of comprehending and understanding of you're trying to deliver. And the second situation, no matter what you're gonna do for the patient, the patient is not gonna feel better, because in the patient's mind, patient is already programmed for the failure. And in this case, you have to give them the answer that you can't help them. So let's go into details. Let's say patient comes into the office really agitated, aggravated, already, not ready to listen to you, arguing with you. While you're doing evaluation, patient either knows everything or really reluctant or showing rejection behavior, frustration behavior. And in this case, what we usually say, again, behaving professionally, we have to say that, look, I understand your frustration. I understand you're in pain. I understand you're upset. I understand you're not happy, but you came to me for help. And if you want to stay here in this office, and if you expect me to help you, you have to, number one, behave respectfully toward all of my staff members. Number two, you have to listen to what I'm saying and do what I suggest. If you don't do that, if you think you know better, there's nothing I can do for you. And let's try to work together. Let's give it a try. You give me the chance and you see if that's going to work for you. If not, you can always leave. So in this situation, you try to reason with patient. You try to show your understanding. But at the same time, you also need to let the patient know that the bad attitude, the bad behavior will not work in your clinic. It will not work in your practice. And the only person who will lose in this situation is the patient itself, because the patient not going to get help. I also get those, let's talk about number two, where no matter what you say, you see that this patient just came to your clinic to satisfy the internal fights, internal conflicts, mental pain. Sometimes you see that people have mental health issues together with the physical problems that they have. And sometimes it can come along, when someone is in pain for a long time and develop mental health issues. We as a physical therapist, remember, we are not skilled to deal with it because it's not covered with, in physical therapy school. We do take psychology course, but it's a regular psychology. All I know is the Maslow theory, when you ring the bell and the dog salivates. So all I can do in the situation, maybe try to get the bell and see what happens. That's all I know in terms of psychology. But if you work for a long time, like me, 20 years, you kind of become a psychologist. You kind of start to recognizing people with mental health issues and conditions, and you also understand that you're not a professional, so you can't really help them, nor refer them because they're not going to listen. So in this situation, don't even try. Don't even try, because you're going to make situation worse for your staff members, for you, for the patient, and that's going to prolong the suffering. The answer would be, I'm sorry, but I don't feel that I can help you. You need to find someone else. You need to find another clinic that you're going to be comfortable with. Do not feel uncomfortable to say no, because then it's going to affect the treatment. It's going to affect dynamic. It's going to affect the process of healing, getting better, so on and so on. So those are suggestions to deal with difficult patients. So remember, 2 choices. Try to explain. Try to give the patient objectives, how you're going to help the patient and why the patient needs to listen to you. And you put yourself in a position of professional. You're not the mom, relative, family member that you're going to tolerate and unacceptable behavior, let's put it this way. It's not your job. And number 2, if you feel that your conversation is not going anywhere, just quit. Tell the patient that you cannot help. That's all. All right, good luck. It's very simple. It's more simple than you think. You don't need to go into psychology. You don't need to take additional courses. Number 1, you try. Number 2, if you don't try, it doesn't work, quit. All right, that's it. That's all. Very simple for dealing with difficult patients. All right, everybody, have a wonderful day. Bye-bye.